Welcome everybody. I'm so glad that it's bright. I can't actually see you. So thank you very much for coming to the talks this morning. Just to say, I've actually changed roles since I started writing this talk, and I'm now in charge of training and education in my pathology unit. And one of the things that I've been tasked with is looking at having STPs and then potentially HSSTs in our departments. We already have support for those posts in other departments in pathology, but not in haematology and blood transfusion, which is my background. So I'm guessing really you've just heard from Philippa, who's halfway up the peak, and actually now you're going to hear from me, who's right at the bottom of the peak, because this is really sort of my pitch to our senior managers about maybe why we should be supporting those people. So I'm going to be talking about encouraging and supporting advanced practice training for biomedical scientists. And just to make you abundantly clear that in my role, I haven't yet had to support these advanced practitioners, but this is something that I'm investigating in my new role. I've been fortunate enough to have spoken to clinical biomedical scientists, HSST students and STP students, and of course I've had time to speak to Philippa as well, and a training officer from Blackpool Teaching Hospitals. So I'm really, really indebted to them for their time and their patience and abundant information. And of course I can see one of my colleagues in the audience now who I have probably bent her ear a lot about supporting these advanced practitioners in my role. So I do really want to mention Dr. Sharon Gray, Brittany Horton and Stephanie Williams, who I've spoken to at length about this, and I know that they would be really happy to be contacted, and the general sense that I get is that people don't want to reinvent the wheel, that the struggles and the stresses that they have been through to secure these posts and then to support these posts, they don't want to see other people going through that. So there does seem to be like a fraternity that I definitely have tapped into about supporting these roles. So, as we all know, biomedical science is evolving rapidly and the role of biomedical scientists is expanding. What's driving that change and what does it mean for our profession? Well, currently we are essential to diagnostic labs, performing analyses which support clinical decision making. And in general, these roles need registration with the HCPC as a biomedical scientist. So our drivers for change include the growing demand for more and more specialised and therefore autonomous roles in diagnostics, driven by our workforce shortages and our evolving healthcare needs and expectations. And additionally, advances in medical technology and personalised medicine require even higher analytical skills, along with clinical decision-making, which is driving this move towards more advanced training for us as a profession, as biomedical scientists. So healthcare systems are under pressure, and demands for diagnostics are becoming increasingly complex. Biomedical scientists are stepping up with expanded responsibilities, and the new NHS 10-year plan emphasises earlier diagnosis, improved integration of services, and the expansion of diagnostic capacity. So it really is a great time to be a biomedical scientist, because all of this increases the demand for highly skilled biomedical scientists. And this means that there are more opportunities for role development, advanced practice roles, and leadership as a service that we provide plays a hugely critical role in delivering timely, accurate testing to support the increasingly complex patient care pathways. And these advanced practitioner roles can support our clinicians by taking on responsibilities such as interpreting complex diagnostic results, advising on next steps in testing, and contributing to clinical decision-making, thus supporting our clinicians and streamlining diagnostics, hopefully reducing turnaround times and enhancing patient care through collaborative, multidisciplinary approaches. So these roles require strong data analysis and interpretation skills in order to make use of AI tools and integrate genomic data into clinical diagnostics. And they also need solid understanding of bioinformatics, ethics, and the ability to evaluate emerging technologies for safe and effective application into our patient care. So these advanced practitioner roles, these advanced practitioner biomedical scientists, will improve efficiency by optimizing test selection, thereby reducing unnecessary investigations, leading to faster and more accurate diagnoses. So this will improve patient outcomes through earlier interventions, better targeted treatments leading to more effective use of the NHS resources. And these advanced practitioner biomedical scientists will support the long-term workforce plan by filling these emerging skill gaps, reducing reliance on medical staff for certain tasks, leading services and contributing to a more sustainable multidisciplinary workforce. So as I say, it really is a great time to be a biomedical scientist. So I did look into some of the reasons why these roles are becoming more required, if you like. Obviously, pressures in the clinical areas mean that some tasks that were historically reserved for medical staff can now be shared to delegated to biomedical scientists. And on my next slide, I've got an example of a survey which was sent out by the British Society for Haematology. So the BSH survey is from 2019. It's a while old, but I couldn't find anything more recent. So the respondents were invited to indicate the three main challenges from the lists above, and figures shown are the number of respondents selecting each item. So we find increasingly that medically trained consultant haematologists are now absent from the labs because they are dealing with cancers. And the brilliant new monoclonal drugs that are available mean that haematology consultants are really heavily involved with these patients who may not have been traditionally considered haematology patients. And so it's realistic to predict that consultant clinical scientists will be required to fill the gap that this is leaving behind at the interface between the lab and the clinical services at the diagnostic end of haematology patient journeys in the future. So I know that this is focusing on the haematology side of things. Obviously, this is what I'm looking into at the moment. But I think that, it's interesting to see that one of the most difficulties that the clinicians are experiencing is the difficulties in staff recruitment. And I know from personal experience, we have many vacancies in our haematology clinical areas, which we are struggling to fill with experienced staff. So advanced practice is defined by the 4 pillars. These ensure advanced practitioners deliver high-level patient care. They lead service improvements, they support development of other staff and the service, and they contribute to scientific innovation. They will form the foundation for autonomous and expert practice within healthcare science. Advanced practitioners engage with multidisciplinary teams, and this broader role bridges the gap between lab science and our frontline healthcare, which only serves to enhance the impact of biomedical science on patient outcomes. As an advanced practitioner in biomedical science, it aligns with the Institute of Biomedical Science by meeting its standards, including professional development, clinical expertise and leadership. And they also comply with the HCPC by ensuring safe, effective and ethical practice within their scope. And while not directly governed by the General Medical Council, their role complements GMC-registered clinicians by supporting multidisciplinary care and contributing to clinical decision-making through expert diagnostic input. So why does this advanced practice matter? Well, we would like to see faster turnaround times because advanced practitioners can authorize, interpret, and really importantly, initiate further testing so that we're able to release those results more quickly. And in urgent and critical cases, this could actually be life-saving. And with their unique insight into both lab and clinical situations, an advanced practitioner biomedical scientist can lead development and implementation, collaborating with lab and clinical teams to help redesign workflows, integrate evidence-based practice, and thus enhancing efficiency and service delivery. And of course, they would also contribute towards research, clinical audit, and quality advancement. So our advanced practice strengthens our workforce by enabling biomedical scientists to take on extended roles, by reducing reliance on our medical staff, and then helping to address workforce shortages. It supports career progression, and of course that means staff retention, by providing another pathway for professional development for biomedical scientists. And additionally, these advanced practitioners will mentor other staff, helping to shore up a more resilient and skilled workforce for the future, which we all have concerns for. So advanced practice improves patient outcomes, it drives service innovation, and assures a resilient and sustainable workforce for the future. So what are these drivers? Don't forget that I'm pitching this to my senior managers as to why we should have these posts. Well, technological. We are driven by advances in automation, artificial intelligence, and molecular diagnostics, which necessitates continuous upskilling into advanced practitioner roles. As precision medicine evolves, biomedical scientists need to equip themselves in genomics and bioinformatics and extended digital health technologies. Our workforce pressures include the growing demand for highly skilled scientists to operate and to interpret complex technologies, all amid our staffing shortages and increasing diagnostic workloads. And additionally, this rapid technological change creates a skills gap, which requires ongoing professional development and advanced training to keep abreast of these changes and to maintain our service quality and service efficiency. So these roles enhance our service delivery by bridging the gap between traditional lab science and clinical care. And this would enable better integrated specialist support, such as genomics and disease monitoring. So of course there are going to be barriers, I think Philippa really well highlighted some of those, and I was pinning my ears back when I was listening to that. I do think I've found that there's been a lack of managerial understanding and support for these roles. They don't understand what an advanced practitioner actually is and what it could bring to the table, and therefore how to support staff to achieve it. And finances, how to justify a higher band post, typically a band 7 going all the way up through the band 8 grades. And they are reluctant to upgrade due to budget pressures. Funding, study time, and travel may not be prioritised despite some trusts supporting advanced practice for nurses. It's a difficulty in finding time for significant development. And again, we've just listened to Philippa saying about the extended amount of time that these positions and these roles need. And they need in-depth support with mentorship and coaching and ability to find the right relevant help for the portfolio evidences from somebody with a significant amount of understanding. And if too much pressure is just put onto the candidate to sort all of this out for themselves, despite their initial enthusiasm and eagerness, and we know what type of person we would be putting into this post, so despite the initial enthusiasm and eagerness, this is likely to lead to burnout and stress, which will obviously reduce that motivation and making long-term development more arduous and much likely to take longer, and I don't want to say it, but more likely to fail. So where can we find these enablers to encourage us to uptake these positions? So in order to support these posts and to make them a success, we need strong mentorship from suitable people and supervision with supportive line managers. They need to understand and value these advanced roles, and there ideally needs to be at least access to a mentor or supervisor at consultant level, or a minimum a senior scientist, I'm guessing. There needs to be structured career development with a clear goal, and that means their job description. And I smiled when I saw Philippa's first slide, and it said the end, and that's what we need to be looking at. We need to be looking at what we want these advanced practitioners to be doing when they've passed all their exams. And we do need to have protected time away from the lab or the bench to undergo training and research. There needs to be opportunities for involvement in clinical decision-making, in service improvement and in leadership. And there needs to be integration into multidisciplinary teams, liaising with medical staff, nurses, and other allied health professionals, and collaboration in order to develop skills in communication, in negotiation, and influence across clinical groups. And it goes without saying that there must be ample opportunities for their portfolio development and evidence gathering to demonstrate this advanced practice. So employers, the major thing here is to have vision and to develop a comprehensive job description for these advanced practitioner roles. And from speaking to colleagues, this is the most important thing that our employers can do. Employers need to provide access to clinical placements and provide mentorship and appropriate casework. Employers play the major part of aligning and training opportunities with service needs, thus ensuring that the advanced skills gained remain relevant and are integrated into healthcare delivery. So essentially, they must also allocate time and resources for study, so that's dedicated, protected study time, professional development, so attending meetings and symposiums and congress, of course, and opportunities for research activities. So our professional bodies are involved in this, of course, such as the Institute for Biomedical Science, the National School of Healthcare Science, and the Health and Care Professions Council. They are the backbone of the advanced practitioner training, ensuring that biomedical scientists are trained, assessed, and supported in order for them to deliver this high-quality care. They must help promote advanced practitioners in the wider healthcare system by advocating their value and promoting these roles. So these bodies should bridge the gap between education, regulation, and the real-life practice. And this helps advanced practitioners to evolve with the demands of modern healthcare, engaging with our stakeholders, and aiding in their career progression. And they also obviously help by providing CPD opportunities, including workshops, online courses and journals, networking and conferences, which are requirements for re-registration and advancement of these roles. So supporting these individuals, by nature of the selection process, these individuals tend to be already motivated and driven, but they may not have the experience in the discipline that they're now studying in. So if the candidate has come straight from university for STP, they may not have that wealth of practical skills that an internal candidate does have. And this must be factored into their training plans along with their advanced practice training. So right from the get-go, reflective practice is required. And again, this may not be something that the candidate is particularly familiar with yet, especially if they've not had much practical experience in a laboratory, or if they are they've been involved in investigating incidents, performing audits, and risk assessment in any previous role that they may have. Or as I say, they may have come straight from university into an STP role. So we need to build a training culture in order to support these positions. We must create and nurture a training culture that values curiosity, peer learning, and recognition of achievements. If there's not been a prior opportunity for advanced practice training in your laboratory, such as for me in my particular laboratory, it will be a big shift to accommodate the training and help other staff to actually understand and really appreciate these roles, which they may not have encountered before. So we can set up groups within our new pathology networks, enabling students to work together, share ideas, and spread the training load. The NSHCS have recognised that networks can provide joint ventures, so several trusts could support a single student or even a small group of students. And then as these students develop and take on added responsibilities, their peers will recognise their achievements and the contribution to the lab and the clinical support which is then available. So future opportunities. Looking forward, the future holds opportunities, as we all see in AI, genomics, personalised medicine, and working across these multidisciplinary teams. There is a huge opportunity to work with clinical data scientists on AI model integration into lab practice, leading digital transformation projects. Implementing advanced strategies such as point of care in communities and remote settings in line with the government's 10-year Fit for the Future healthcare plan. These roles will have a substantial part to play in multidisciplinary teams with shared responsibility for patient care, monitoring and treatment. And there is ongoing discussion about appropriate training for extending prescribing rights for clinical biomedical scientists. So, call to action. to my managers and to anybody else who wants to listen to me. As a biomedical scientist, we are already making vital contributions to patient care. And now is our chance to advance our clinical practice and gain greater autonomy and lead innovation in diagnosis and clinical laboratory medicine. We need to consider pursuing advanced qualifications, and that is including STP and HSST, expanding our scope of practice out of the lab and be the driving force behind diagnostic excellence and clinical involvement. Employers, you need to recognise the value of advanced practice in improving diagnostics, service delivery and clinical patient outcomes. Make sure that there are clear pathways for progress, considering advanced and consultant level roles within your organisation. Support postgraduate education and training to enable these roles, facilitating access to professional accreditation such as the National School of Healthcare Science or HCPC as a clinical scientist. You need to embed advanced practitioner roles into our workforce planning, transformation strategies and clinical work streams. You need to promote clinical expertise as part of biomedical science practice, offer meaningful career development, opportunities for biomedical science and improve workforce morale and retention. So our professional bodies recognise these advanced practitioners as essential to modern patient-centred healthcare. Develop clear professional standards for consultant-level practice, facilitate access to accredited training routes and consultant-level practice. Facilitate access to accredited training and routes and further help HSST pathways. Advocate for formal recognition of advanced practitioner roles with national healthcare policies and workforce strategies, and support equitable access for development opportunities across all regions and all specialties. Provide better guidance and resources to assist biomedical scientists in meeting these registration requirements. Collaborate with our employers and our educators and our regulatory bodies to support and streamline progression routes. And finally, champion the visibility of these new biomedical scientist roles within multidisciplinary teams and strategic forums. So finally, advanced practitioner opportunities enhance biomedical science and expand the roles available to biomedical scientists through clinical responsibility and evidence-based innovation. It enhances patient care by enabling biomedical scientists to deliver specialised and patient-centred services alongside and supporting those provided by our clinicians. So collaboration is central to the development of these roles. Having the initial vision and foresight is vital in developing the roles that is required. And collaboration with other healthcare professionals, including doctors and research scientists, is vital to ensure the required training and expertise is attained, which should then foster innovation in these roles, leading to improved patient outcomes and benefits to other stakeholders who are involved with us. Supporting advanced practitioner in biomedical science opens up many opportunities for us as biomedical scientists, widening our horizons and elevating our profession, bridging the gap between the lab and the delivery of clinical medicine. And this should hopefully ensure a more responsive, efficient, and evidence-based healthcare system for our future. Thank you.